Feels like a smorgasbord of international experience from which we can all draw something. We've got a really great diverse range of panellists from various sectors to draw on what Sarah's talked about and respond to your questions as well. I'll try and leave as much time as possible for your questions because I sense this is going to be a question-heavy session. Okay, let's work through our panellists. First of all, there's Belinda Allen, who is General Manager, Services and Sector Capacity for ACCPA. She's responsible for ACCPA's sector capacity portfolio consisting of funded programs, members services, consultancy, learning and events, workplace relations and innovation. Prior to this job, Belinda held the position of Director of Member Services and Marketing for National Disability Services, which is the peak body for disability service providers. Welcome, Belinda. It is a long train of panellists, isn't it? Dan Stubbs, next up, is the Victorian Disability Worker Commissioner and is the head of the Commission. He was appointed in October 2019. As Commissioner, Dan's responsible for regulating the conduct of all Victorian disability workers. He responds to complaints about disability workers and has the power to ban unregistered workers from the sector for breaching the Code of Conduct. Dan has a disability, he has a sight impairment, he has an understanding of the reliance people have on disability workers and the need to ensure services are safe and high quality. Dan's previously worked in the community legal sector and has a long history of leadership in Australian systemic advocacy organisations of people with disability. Welcome, Dan. Lloyd Williams, up next from the Health Services Union. He's, of course, National Secretary of that organisation, has more than 30 years' experience in union leadership roles. Prior to becoming National Secretary, he held the position of HSU National President and was the Secretary of the Victorian Mental Health and Disability branch of the union for more than 20 years. Obviously, a lot of experience as an industrial advocate and lobbyist, has led industry-wide bargaining and high-level participation in policy advocacy on industry service and workplace reform in the health and community services sector. Welcome, Lloyd. Edwina McDonald, Deputy CEO and Director of Policy for ACOS, a well-known and accomplished national community sector leader with a strong human rights and legal background. Edwina is Co-Deputy CEO and Director of Policy and Advocacy of ACOS and a lead spokesperson you would have seen in the media. With more than 2 decades of experience in research, policy and advocacy in government and the university and community sectors, Edwina brings deep gender expertise, global advocacy experience, including at the UN, and a strong community services and development background to her role. And finally, Susan McGrath, who's a Senior Policy Advisor at National Seniors Australia, focusing largely on aged care and healthcare. This position follows on for Susan from nearly 5 years as Senior Policy Advisor to the Every Age Counts campaign to end ageism, and she also had an earlier position as National Policy Manager for COTA Australia. So the main thing I wanted to hear from everybody on this panel who's not Sarah is, when you hear about those models that are being trialled overseas, is there anything that leaps out at you and makes you think, well, that could work here? And is there anything that makes you think, that is not going to work here? If anybody's had a thought or a spark whilst listening to Sarah, share it now. Uh-oh, blank looks. Wrong question. Maybe Dan?
We've got a couple of takers here.
Okay, Dan.
I think the obvious thing for us in disability is when Sarah was talking about requiring registration in some countries, so mandatory registration for aged care workers in some jurisdictions, and extending that sort of thinking into disability. That's a contested space, and there is debate over it, but I think we will end up in some way getting to requiring disability workers to register. That's what the recent Disability Royal Commission recommended. It'll be super interesting to see what the NDIS review that's going to come out any minute says about that too, but I think if we're going to properly continue to lift the standard of disability services and reward the workers who are, many of whom are doing an amazing job, that's one of the pathways to that.
Okay, thank you. Lloyd, do you want to take over too?
Yeah, I would agree. We've now had 2 Royal Commissions that have recommended mandating qualifications and a national worker registration scheme, and I think they are both correct recommendations, and recommendations that the government should take up with a matter of urgency. Mandatory registration and qualification frameworks tied to career structures will lift the standing of both disability support workers, aged care workers. It'll lift the value, it'll lift the professionalisation. So we should see it as a positive that both supports workers, supports better quality of care, and supports greater mobility across the care sector. So if you work in disability, we shouldn't have a disability registration scheme and an aged care registration scheme. People should be able to come in. We should have the similar infrastructure that allows mobility across the states and across the country, and between providers.
So would that mean a sort of, I mean, this is something I've just come up with, so it's a ridiculous idea, but would that be like a sort of a Lego approach to qualification where you build up your own individual collection of qualifications and then you are mobile around different sectors?
One of the things that our union advocates is that you have a registration and an accreditation scheme. So workers can enter, they don't have to be qualified to enter, they'll enter on a provisional basis before they get their qualification. Once they attain their qualification, they are then fully registered. But then when they advance in their professional development and undertake further development and training, they can get accredited for other streams of expertise. And I think that then add value for that worker to then use that to progress throughout the industries. But we also, as Sarah has correctly identified, that we have to have aligned career structures that promotes people moving through and getting higher qualifications as well.
For people who work in these sectors, and I'm sure it would apply to a lot of the people in this room and the people that they work with, there is such an escalating feel of bureaucracy and obligations that are onerous on the individual employee. How do you balance the need for regulation with not driving your workforce completely nuts?
Well, I don't think it'll drive the workforce nuts. I think that it's about setting quality standards, and that's what both Royal Commissions have said. We do it in other industries, you know. We don't think about it over in construction, but, you know, we have mandated qualifications in the electrical industry and a whole range of industries, and they don't impose, you know, that sort of regulatory burden on those structures. I think we have an obligation and a duty, particularly where we're supporting people who are in many ways can be vulnerable. So I think we have a duty to do so.
Yeah, that's a good comparison. Oh, yes.
Thank you. I just wanted to add, while I completely agree with you, Lloyd, these reforms are needed. Nobody disputes that, you know, the Aged Care Royal Commission was a point of reflection for us all, that certainly it was a cry for help from a sector in need. But having come into the aged care sector from disability several months ago, I must say it feels as though we are flying a plane at speed while trying to build it. So the reforms are coming through so quickly that I do worry that we won't be able to take our key stakeholders on that journey. We're definitely getting some altitude now, which is fabulous. We're seeing some great pieces of work come down. Mentioned earlier is a 15% pay increase for our workers. We want them to feel valued, and we have come from a starting point which was very much compliance heavy, going straight into COVID. The sector was feeling incredibly flat, so they are fatigued, we know that. But how do we build them? Because I think back to when the NDIS was introduced, that was a moment of celebration for the sector. So that reform came from stakeholders who were very much on message. We worked together to build that reform. And I think there's still some work for us to ensure that there's trust in the sector, and most importantly, sustainability, both financial and worker sustainability. So I do worry that the reforms are building, we're in the right direction, but we've got to make sure that we've actually got the right people on that plane. We've got enough people to build the plane so that we can continue to fly.
This is quite an exciting aviation analogy that we're building. We've got a lot of views coming through on the feedback, and I want to put to you, also one has observed that Lego building block qualifications equals micro credentials. Thank you, good penny drop. One questioner has asked, what are the barriers to mandating registration? On the comments here, there's a lot of support for mandated registration, but as long as it's done the right way. Where are the barriers? Is the resistance primarily from workers, employers, or from governing bodies?
I might start. I think one of the areas of contention is, and this happened with the introduction of NDIS and in the introduction of our scheme in Victoria, where a lot of people with disability who were excellent self-advocates maybe, and were good at maybe managing their own package, said to government, we don't want you telling us who we can employ to be our workers. If we want to employ someone who's a student doing something that I find useful, then I want to be able to employ those people, and I don't want to be told by government. I think where we may end up, and of course that's really good for them because they've got a lot of agency and capability, and decision making is something they're completely able to do. Where we may end up is, particularly in disability, and it's incredible to think that disability is one workforce. It's so incredibly diverse when you think about all the different disabilities and all the different types of work that we ask workers to do. To think of it as one workforce is staggering. So we may have different levels of registration, which might be at one end more like what's the current NDIS worker screen, which is basically a police check, and then maybe further along we have a sort of registration that requires people to meet a whole lot of standards and qualifications and things like that to allow for that choice and control that people are looking for.
Susan, I'm going to bring you in now.
Yeah, I think it could be timely to bring in the older person in the aged care system into this discussion, because we're focused on issues like registration. I'm not arguing against registration, but what I can say is that older people overwhelmingly, in all the research, in all the anecdotes, say that they want home-based care for as long as it is possible, and the practice is demonstrating that. We know that there are exceptionally thin markets in a lot of the parts of this country. Supply, worker supply is incredibly problematic, and so the issue of registration has to be seen within that context as well, and would need to be managed very carefully, not to be adding to the problems of supply and availability for home-based care in particular, and I'm sure it also relates to residential care, but in terms of the expectations, the desires of older people, this could all of these things have to be taken in concert with each other. And it goes back, the question you asked about the overseas models that Sarah outlined, and the reference to the example where there's a lot of cooperation across providers.
I'm going to ask you about that next.
And so obviously that would be hugely desirable, and hugely desirable where there aren't markets, labour markets available to support older people in their homes, but it goes back to the funding models that Sarah's talking about. It's incredibly hard to see how that cooperation can exist within the kinds of funding models that have led to this very disparate market and all sorts of small groups of, particularly in regional, rural and remote areas. So it's all very well to have the idea of the ideals and the principles, but it will be very difficult to pull those off.
Yeah, I was interested, Sarah, too, in the discussion, your description of for-profit and non-profits working together. And I sort of was reminded of what Carolyn was talking about in the previous session, where she was talking about non-profit providers being able to provide services even where the recipient didn't show up and so on, but it was not something that for-profits would ever do. And I mean, to what extent does that structural difference make it difficult to achieve a completely seamless collaboration, even in high population areas where you have a lot of demand and reasonable access to workers? Maybe, Sarah, do you want to take it, or Lloyd?
In the New Zealand case, because there's block funding, and there's actually cancellation policies written into it, so providers are not paid per visit. They take on a certain number of clients. There is this mix in complexity, so you don't have, which we've seen in the home care packages market, some providers coming in and creaming off less complex cases and leaving the very complex cases to the not-for-profit.
Which is exactly what happened in the first years of the outsourced employment provider.
Yeah, exactly.
But, I think, but I think the reality is, even one can be very critical of the way that this marketisation is really, I think, in many cases put profit before people. The reality is there are profit providers in the sector. That horse is bolted. What we really need to do is to manage it, and there's no reason why for-profit providers can't be providing very good quality care. But they are in receipt of government funding. So that would, I suppose, be my response, Dan, to people concerned about mandatory registration. I can understand that. But if you're in receipt of government funding, then government actually has a duty of care to make sure that that money is spent on good quality workers, good quality workforce who are skilled.
It's part of marketising the system. We have to have those checks and balances, absolutely.
And it's
Just
one of the
Lloyd, before you start, can I just ask if there are questions in the room? Wave your hand, and then while Lloyd is talking, we will get a microphone to you. Anybody? Right, I'll keep an eye on you all. So if you want to jump in, let me know. Lloyd.
And to me, one of the things that's always defined, some weird logic in this sector is that the lack of collectivisation is really stark across service providers. What we have is funding from government for service delivery, and then we establish this competitive market where providers do not collectivise across workforce support, training development and sharing of ideas. And I think that's one of the fundamental flaws with the current system, is that lack of collectivisation of solutions and providers working together, particularly in thin markets and rural and regional areas where service providers across local government, aged care, disability support should be able to come together and create collective vehicles to do things better.
Okay, so in this conversation across various sectors already today, we've had a bunch of exchanges about what it means when multi-employer bargaining agreements happen, what the knock-on effects are for other sectors. Can I call for some insights from this panel, I don't care from whom it comes, about exactly how multi-employer bargaining has influenced workforce planning?
Well,
I thought you might.
well, the first thing I would say is that collective bargaining hasn't worked in the sector because it's government funded, and the government's pricing is always based on the minimum award. So what we see with modern awards is that they were never meant to be the minima. They were meant to be, they were never meant to be the maximum, they were meant to be the minimum. But because government funds at the minimum, the awards become the maximum. So collective bargaining to date hasn't worked. We hope that the new reforms that government has recently brought in around supported bargaining should add some benefits by bringing the funder to the table and being able to support that process. But when you have funding based on the minima, the awards become the maximum and collective bargaining falls away. So what we bargain about is not wages because they're set by the pricing, but you bargain around the edges. So it doesn't work that well.
Okay, and when we're talking about a culture of getting smarter about specific services that are provided, answering individual needs, then does that take us further away from a position where we can take a holistic workforce approach to this important issue of remuneration?
Well, I think it does. So, I mean, I think government, as the funder, needs to take a greater role in stewardship. There's so many more things that we can do. We talk about mobility. How do we create mobility? Well, you have better career structures, you have better training, but I think also government could support portable leave schemes, for example, so that workers can move across the system. We need to package more secure work for workers. Workers in both the aged care sector and the disability sector have multiple jobs. You shouldn't have to have multiple jobs to eke out a decent living in this sector. So I think that's where we can do better, and the employers collectively can work better to provide more secure hours so people, are retained. And if they wish to move through the sector, they can do so without the risk of losing important leave entitlements like long service leave and personal leave. So you have a portability scheme that also supports workers moving around and enhancing their career.
Edwina, does that sound like an achievable vision?
Yeah, look, I think it's pretty clear from what we're seeing at ACOS that pay and conditions for workers is, and from what's been, earlier today, is a real pain point right now. We've got, in service, people working in our sector, as we all know, it's a care sector. People are passionate. People are really committed to what they're doing, and we hear that, and we hear that the demand is increasing, that people are increasingly in need, and there's a commitment to providing that, but also this burnout that we're hearing about and the financial stress. And when we're hearing stories from people like a financial counsellor who's told us that they've left the sector to be a truck driver because it will pay them more, or a person who is working in emergency support services left the sector to work at the local supermarket because it will pay more, we're really hearing, and it's increasing, and I know it's I can see all the nodding, it's not news, that people are leaving our sector because of financial need. We've had a homelessness service in Queensland told us that 3 staff members working for them became homeless in the last year. So this is the reality of people working in our sector, and there's no doubt that having better pay and better conditions for workers in our sector will deliver better services for the people that need them. And I think it's very clear that, and the other bit that's very clear is we need this to be funded. So we need to be looking at the funding strains that services are experiencing. We know that we've had chronic underfunding. We've got real cuts to services as we're facing increasing demand due to inadequate indexation. And what we need is to have the pay and the conditions improved with the funders at the table to ensure that funding comes through to pay the real costs of service delivery.
So on one hand, we've got this sort of argument that you can't keep pouring money into a system when there's holes in the bucket. But what I'm hearing from this panel and from some of its predecessors are that all of the other adjustments to retention measures and training and restructuring of the way services work and permeability between different sectors really isn't worth anything until you address the fact that people in the sector feel that they are being paid at the bare minimum, if that, while of course we know from recent years they've had some of the hardest years of their professional lives and now are in a cost of living spiral as well. Okay.
Yeah, I mean, we're talking about a sector, as we know, it's 80% women, it's gendered, it's about the undervaluation of care, and we do need to pay that adequately and fund it adequately as well. And that, we do need to fix that concurrently with fixing the funding model. There's clearly problems with the funding model. But we're really at the precipice right now, and we need to make sure we don't fall off in terms of attracting and retaining staff.
It is important what you call things. Do you think, or does anyone in this panel think that using the term the care economy or using that word to summarise what's done by all of the people representing different and very diverse jobs in this room, do we retire that word? Seems a bit mean to retire the word. It's kind of a good word, but is it too gendered to continue with and hope for change? I know there's a question here. I'm totally coming to both of you.
I don't think disability support workers are paid to care. They're paid to do a whole lot of things, and sometimes they do care, and that's okay. But people who care are who cares for all of you, your family members, your spouses, all those sort of people. People are paid to do a really important, sometimes hard, sometimes incredibly rewarding job, and it's not to care. We don't call people carers.
So that word sounds like you're doing it because you love your job, and if you get paid, that's brilliant, but
And that's a short distance between the exploitation of these workers, because we know a lot of these workers have what we often see as an overdeveloped sense of obligation to their job and putting in extra hours and extra work and everything, and the burnout that we've talked about earlier today happens because of that. So yeah, it's kind of all related, yes.
Okay. Susan, keep it quick and then I'll get to these questions.
The other angle on that older people, when we ask them what they want from carers, a key component of what they talk about with us is care. And so it is, if we go back to Sarah's point about relational models of care, they're not interested in the illness-based model of care. They're not interested in that approach. They're interested in strength-based models and recovery models, and they want a caring, empathetic relationship with the people who come into their homes or in the residential aged care environment. And I'm always really wary of dumping terms like care because they're associated with women's work. And the idea we've got to professionalise, not just to bring men into it, but to demonstrate that it's important and real work.
Well, it's actually the care and support economy. But I think that the key issue here in terms of the language change is linking it to the economy and saying that it's an important part of the economy. I think that is a critical change. But what we have to do, and we can't just talk about pay, I mean, 15%, and I've seen some of the 15%'s not enough. We agree, we're still chasing 25. We're still chasing better career structures, but we need that other employment infrastructure in place as well. So things like I talked about before, portable leave, a registration scheme. So all of the other infrastructure that creates decent jobs.
And that makes this workforce feel as though its skills are appreciated and called what they are, and they have some sort of agency in designing their own workplace.
I mean, I think we need a lot more on-job traineeships, paid people in paid work, so they're being paid while they train as well, and there's just not enough across disability or aged care.
This is super similar to what we were talking about with early education too, right? You're not there to be a warm body, to be just a random other person in a room. You're there to deploy the skills that you've acquired. Belinda, quickly if you can, and then I'll get cracking on
be super quick. I think it's how we define care. and perhaps we haven't spent enough time thinking about what care actually means, and I think we have an opportunity to redefine that. But I also just want to say that stage 3 of the work value case has certainly also raised indirect care workers, and I think sometimes we forget about others who don't provide that direct care, and yet they are critical components of our sectors as well.
Great point. Okay.
Yeah, Clayton Spence from Suicide Prevention Australia. Many people enter, I'm thinking particularly community services sector, as a volunteer or as a worker from a place of lived experience. But lived experience brings its own challenges, great benefits because they understand the sector and understand the work often, but often perceived barriers to qualifications, the perceived barriers of what seems to be over-bureaucratic assessments and not recognition of lived experience. I just wonder if the panel want to speak to that balance of lived experience with qualification.
Yeah, there's some questions that have been coming through too, and I think this is an allied issue about access for people who are homeless or struggling with a mental illness or experiencing family violence. You seem poised to answer, Edwina. I feel that you're...
Yeah, I agree. Yes. Yes is the answer, I think. But we need to find a way that recognises the value that people with lived experience bring. I mean, people who've been on income support and their experiences of income support and what that would mean in terms of working in, many of the services, many in the employment services, for example. It's this idea too of voice, that Sarah spoke to, that, Mark Considine talking about the focus on voice, and voice in terms of, the funding model and how the funding model works, but also voice in terms of how services are delivered, how they're structured, how we think about the people we're employing, the work we're doing, and how, as service providers, as a sector, how do we bring voice into the centre of what we're doing as well? And that's very much a part of bringing people with lived experience into the workforce as well.
Well, it's not all that long since you had all male cabinets and ERCs in this building making decisions about childcare, about all sorts of stuff. And I think one valuable thing that we've learned as a species over the last couple of decades is the real demonstrable truth that diversity in decision-making groups leads to better decisions. And I feel like that's an evolving process, right? But it matches with what we've been talking about today, about respecting individuals and their needs, whether they are employees in one of your sectors or whether they are people who are receiving services. That's my comment. This is Q&A now, sorry.
Just on the lived experience, I just think you have to apply the same principles. You have to value and reward people's skills and experience with decent career structures. And our union in Victoria has done some terrific work for lived experience workers in mental health in terms of developing career structures that recognise no matter what qualification you bring with your lived experience to providing support for people with a mental illness or whatever the environment is that you're properly recognised and valued and paid for the skills and qualifications that you bring.
And I think once you look at all of the stats about mental illness and anxiety arising post-COVID, we're in a new age of acknowledging that exists and knowing that people can work as legislators in this building, certainly as journalists, and all through every profession and line of work, whilst also managing illness of one kind or another. And that's another great advance. Question here.
Karen Phipson from Australian Unity Home Health. One of my observations in the sector is that, and the broader population at large, is that health literacy is low. And I'm quite curious to hear from you what role that connecting public health and community-based healthcare and also connecting chronic disease prevention and management might play in building the skills of our workforce and also the value of not just the care we provide, but the healthcare and understanding the indicators day in, day out when you're spending time with people. What opportunities could that bring, and is that something that you've seen in other sectors or other areas that we could build on?
I completely agree with you. I think that is something, that interface is something that we do need to carefully review. We're certainly seeing with the strength and quality standards that are coming down next year in aged care have a component of core competencies that are starting to look at increased health conditions, chronic illnesses, etc. And I do think micro-credentials have a space there as well. So we have the strength and quality standards. We also have ongoing training that will come up in addition to conversations around mandatory qualifications. So I think there's certainly a component that we can build in there that also strengthens career pathways, learning pathways, etc. And I think this goes to sort of harmonisation that we've been speaking to quite a bit today.
Any more questions out there? Yes, we do have one. Yep.
Oh, sorry, it's for Sarah, really.
Great.
Sarah, the Wales mandatory registration system, would that also help us with the data? Because every sector here needs really good data for forward planning.
I'm glad you brought that up. Yes, it does, like Scotland, Wales does collect some workforce data, but it actually kind of triages it with its data it gets from the Welsh Care Inspectorate. So they bring those data sources together. So yes, I mean, I certainly think that that's something to have a look at, because we've had very disparate systems in Australia, and particularly in terms of not just around workforce, but in terms of the quality standards in aged care, they've been very poorly. I was going to say policed, but they've been very, very poorly monitored, and it's only egregious examples of failure to meet those standards that have been recorded at all. Whereas if you've got a Welsh Care Inspector going into a care home, for example, asking to see the books on the workers and evidence of how many supervision sessions they've had in that past year, for example, they can actually then use that data, and they record that data because they're obliged to through the registration process. So Wales is a relatively small jurisdiction compared to Australia, very contained geographically, and social care is still organised to that local authority level, which does provide that kind of local focus that I think in Australia, and it's not just the federal structure, but I think because the federal government is responsible for the two largest programs in disability and aged care, we've really lost that local focus, which, is a great problem. But no, that's good. Thank you very much for bringing that up, because that is an advantage.
Belinda, I think you've got a contribution, then we'll head to the next question.
Yeah, I think being data-led and evidence-based is absolutely critical for us when we start talking about sustainability of these sectors. And one thing that has been top of mind for me is there are quite a few data collections now. So particularly in aged care, we're now seeing quarterly financial reporting. We have responses to 24/7 RN nursing requirements, for example. So my question is, how is that being shared potentially moving forward, and how can we ensure that some of that data is coming together in a way that we can develop insights that support some decision making in the sector?
Thank you, panel. Let's take the next question. There it is.
Thank you. Kath Maloney here for Services for Australian Rural and Remote Allied Health. I'd just like to make a cautionary comment about mandatory registration, particularly in thin market areas where it's going to be important to not put too many barriers in front of local workforce, local rural and remote workforce, local First Nations workforces to attain certain qualifications. I was interested in Sarah's comments though about the different ways to achieve a consistency, particularly interested in your comments around the employer's role in assessing RPL. And I was just wondering how that might work here in Australia.
Well, I think RPL is an extraordinarily important component when we start thinking about qualifications and experience. And there needs to be a mechanism, but the employers need to be, have the capacity, and some very large aged care employers actually run effectively as registered training organisations already. So in effect that they're doing that. But in both Scotland and Wales, it's on the employer to do this assessment when people are first registered. So within their first 6 months, they have 6 months before they need to register. And often people are coming in with no background. If you're thinking of jurisdictions like both Scotland and Wales, very high unemployment. So you've got people coming into jobs who may not have considered that before. And so there is this kind of sifting process in the first 6 months. But as I understand it, employers or providers are trained to do that work. They are accredited to provide that RPL, which is clearly, yes. Otherwise, they'd all go tick, tick, tick. Yes, of course, they're skilled. Yeah.
I'm aware that we're really rapidly running out of time, and I know that we've concentrated mainly on aged and disability care, but of course there's a lot more to community services and care than that, and I'm really conscious that as we've gone through all the different sectors over the course of today, there are, even the effects of COVID were different for different sectors, and so I wonder if, and forgive me that this is not going to be as long a conversation as it warrants, but I wondered if Edwina and perhaps Belinda could give us an overview on the specific issues that might arise that work differently for people who are working in with homelessness, mental health, alcohol and other drugs and so on. I know it's a giant brief.
Yeah, I mean, I think there's many parts to that question. I think on the COVID and the disaster front, we know that many of these services are grounded in the community. They're locally based, so they're delivering the services in the for what they're paid to deliver, but they're also doing all these other bits and pieces. So in the COVID response, we saw that community services were the way in for the most vulnerable people accessing services for other things and then being supported in so many ways through the COVID response by community services in a situation where they're already underfunded. And I think when we talk about the underfunding, I mean, we need to kind of be clear too around what's not funded. And I think, and I can see it on the questions too, yes, pay and conditions and professional development and proper supervision. But also, I mean, we're talking overheads, we're talking administration, we're talking IT, we're talking core things to running an organisation are just not funded. And, what other industry would put up with that? What other industry would have an arrangement with government where they go, well, sure, like you can go and deliver these services, but we're not going to fund you to, respond to, the reporting requirements we have. We're not actually going to fund your IT infrastructure. We're not going to properly fund the training and development of staff. And that's the bit that we need. We need a reset to look at, this particular sector and how do we ensure that we're actually properly funding the services, the full cost of the services that we're being asked to deliver.
So what you're saying is for that slice of the sector that even talking about mandatory regulation is just so pie in the sky that it's doesn't feel relevant.
Well, I mean, I think in terms of the broader community sector, that we've seen the role that it plays when a crisis hits. We know we've got this, forecast of another impending disaster season upon us, and we know that the community services sector will be there. They will be there on the ground responding. They will be supporting people at that time of crisis, and that the government relies on us to do that, that this is something that is a core part of the system. And we know that that's actually going to increase over the coming season as we've seen the change with the ADF and the kind of the withdrawal of that from the support mechanism. But there's not additional funding into the community services sector to fund this work, and that comes to adequate funding for the sector. It comes to flexibility of funding to ensure that where there is funding, the sector can move within its funding grant and the way it's funded to provide these services as the people on the ground who can see what is needed at that point in time.
Belinda, would you like to wrap it up?
Yeah, look, more than 60% of providers are currently operating at a loss, which makes it very difficult for them to be innovative, to think about continuous improvement. It means that your focus is very much on just trying to survive. And I think, we had enough of that. It's a sector that was systemically underfunded for so long. We need to think differently about what this looks like in the future. We know that conversations are underway, and they're brave conversations. They're around, communities and consumers actually covering some of their own cost of aged care in the future. So I think we're starting to think a little bit differently about how we support a growing sector. We often hear baby boomers are coming. They're actually already in the sector, which is why there's that tension between trying to change so quickly, but doing so in a way that's sustainable. So it's a bit of an issue for us. We know we need to change. We need to do so quickly, but we also need it to be right, and we need it to be completely funded so that we can do it in a way that creates a sector that we're all proud of.
Lloyd has just begged me with his eyes for more time, and Lloyd, you have 60 seconds.
The whole sectors have been in this defensive crouch because of the funding system and how government has treated the sector over a long period of time. I think that in terms of change, we have to look forward in terms of saying the benefit of workforce infrastructure programs create a benefit now and into the future. So in terms of building a registration scheme or a portable leave scheme and better training opportunities for people, we have to look forward, and I know it takes work and it's all about design, but if not now, when?
Thank you so much. I am now so full of metaphor that because I think, over the course of the day we have got out of the defensive crouch, we've got onto the plane, we're taxiing, we've read the X-ray, we've had the colonic, we're recovering. No, seriously, it is such a complex set of problems, but I tell you what, it's been so fascinating today to hear all of these great brains who are working separately on separate issues in separate sectors come together and talk about the patterns and maybe the ghost of a solution, which I think is tomorrow's big opportunity to chat to each other, to share ideas, to unpack the things that you've been scribbling around along madly in notebooks as you listen today. Could I thank very much the members of our final panel for today, Sarah, Belinda, Dan, Lloyd, Edwina and Susan.